Hi everyone. My name is Rajesh Bose. I work at Qure.ai as a director of programs. And I think now the tone is set, you guys understood I'm not the core tech guy, I had to take the help. So similarly in my company, I'm not the part of the tech team, I'm the part of the operations team. As you all know, right, we have anything, right, any tech product or any AI product, anything that is there, it's like currently across the globe, operation is chaotic. So my role is to streamline the operations across the countries, across the health systems, and we are basically an AI in radiology company, or you can say oncology. We have different use cases, so where we use AI to screen lung cancers, screen tuberculosis, and screen there are like certain diseases, whatever we could get from a chest X-ray or from a brain CT. That is what we are doing. So my session today is going to be what is anomaly detections and the use cases in anomaly detections in healthcare. But before that, I'll just give a very brief context on my company and what we do. So as I said, we are currently in 90 plus countries. So 90 plus countries, you can understand. I mean, we were talking about patient data, regulatory landscape. So that means 90 regulatory clearances we have. We are regulated to work in 90 countries. This includes very remotest of the remote countries in Latam, Africa, and other part of the globe. And currently, we are impacting 25 million plus lives we have impacted already. And we are phenomenally working in US with 18 FDA clearances and 3,000 plus sites. Sites means it could be a hospital, it could be a screening center, anything. So that is where we work it. And how we work is, the business model also, I'll just very briefly walk you through. So mostly it's an AI tool which can be integrated in the X-ray consoles, CT consoles. So, anywhere, any hospitals. So for example, if you're working with NHS UK, so there would be a contract with NHS UK and the hospitals would be integrated AI. That product is called QXR. The idea of integration is screening of the use case the hospital want. We always keep it to confine into a couple of use cases, though the product has capability of screening around 30 diseases. This is to make sure the operations, as I said in the beginning, not going very chaotic and very confined and very streamlined. And we have a big team. We have an office in Bangalore as well, and around 300, 350 people we are currently, and 100, 150 AI engineers we do have currently. And we are one of the AI model which is being recommended by World Health Organization for use in the settings where there is no reader. That means there's no radiologist or doctor is not available. You can use it for tuberculosis detection. Just coming to the topic, see, anomaly detection is like, as you know, right? I mean, it within the name itself. What is the application of it in healthcare? But in simple words, it refers to any process of identifying any unusual patterns. So, for example, take someone who's having, high heart rate. So, heart rate is like there is a normality set. The normal heart rates we all know. So, someone has an abnormal heart rate. Among a big data pool is the anomaly in that. That is where, in simple terms, anomaly in healthcare comes. And this is everywhere, right? I mean, it is not confined to healthcare or health system. Like I think anomaly credit cards and banking frauds are one area where anomaly detection is being used. So, for example, you have a pattern of spending. So someday, the bank is realizing that there is a huge amount of spend in three or four transactions back to back. So that is an anomaly from your existing pattern of spending, existing data. That is where then there would be an alarm going to the bank and the user. So that is the simple commonsensical application of anomaly detection, and this is across the industries. This application is used, and healthcare, when it comes to use this application in healthcare, as previous speakers mentioned, so there is a lot of regulatory concerns also. We cannot, for example, if there's money going out of your bank, you can definitely intimate to the user. But if your heart rate is more, you cannot intimate to user, hey, boss, you're going to get a heart attack, go fast. Because, there are limitations in healthcare. You cannot communicate to your users like how the notifications are set, what is the tonality. And still in Indian health system or in any other health system, the control of information is very much regulated, and that should be through a, authorized medical professional. So though AI is growing rapidly, but we haven't reached a space where companies cannot, dictate or like guide you towards the next steps. It's always an advocacy. It's always an informative thing. That is how where we are right now. There are certain areas like mental health and all that, there's a session also coming in mental health. where it is going to come, like, how it is going to, it's a little more active currently. And so, as I mentioned, there are examples in fraud detection. In medical equipments in hospitals are some area where we work. Like, there are like some pattern 6 SAGs, impulses of this taken SNCU. So, for example, there has been instance of fires in SNCU. SNCU is newborn unit. So, if someone might have looked at this data of which machine this has come, there are 6 SAGs impulses which is getting from the machines. This has been closely monitored and sent the feedback. This mishaps could have been avoided. That is the power of anomaly detection. In India, in many settings, these things are not happening, so we tends to go for adverse effects. Now, coming to type of anomalies to give a context, point anomalies occur when an individual data point is significantly differ from the rest. As I exactly said, the heartbeat, or the glucose level. So anything could be this. This is typically easier to detect and would not be. This is the most common type of anomaly. And contextual anomalies, that is like anomalous in a specific context, not in all, not always. For example, we are tracking climate or temperature. So like suddenly there is a dip in May or April in the temperature. So contextually, if it is in December or January, that is a normalcy thing. But if it comes in May or April, that's a difference in contextually anomaly. So collective anomalies are group of related data points that are collectively anomalous. Take a recent example. I had a glitch when I come here. So if that is like once in a glitch, it is okay. But every third session or fourth session there's a glitch happening, then we have to investigate and understand what exactly is the there is a scope for us to observe, understand what exactly is happening. So that is simple way of telling it. So your computer getting your Windows is getting reset or like getting recovered. Once in a while, that is where the pattern is. But if it is happening frequently, or all the windows in all the users are getting the same issue, then that is an anomaly. So that has to be resolved and understood. So I think the conceptually it is very clear and simple. There is no rocket science around it. I hope that is clear. So again, this is quite repetition. I'll go faster. So as you can see here, like what is point anomalies, which has been mentioned, and contextual anomalies, as I mentioned, the dip in the temperatures in a specific context is what we need to identify it. And this is exactly collective anomaly I said, like exam. So this is to build the context and bring the context. So once you understood the basic foundation of it, then you can understand why it is important in healthcare, right? And healthcare, again, healthcare is where we are going to talk like in detail. So healthcare, the issue with healthcare is one is, as exactly the previous speakers mentioned, the regulatory landscapes and the data privacy around it. And also it is not as matured comparing to like other AI, other AI, for example, cybersecurity or telecom. Because ChatGPT is there if you want any information, but help me, you cannot, and I can take information from ChatGPT and use in this presentation, and I've used it. But in healthcare, a doctor cannot use ChatGPT and prescribe the medicine, because end of the day, that is gonna directly involve, impact, and influence one's life, right? So that is where healthcare becomes very tricky, very complicated, and very demanding also. And sorry, I forgot to ask, is there anyone who works in the healthcare as a provider or doctor or someone? Well, not in the hospital settings? Yes, good to know. And is there anyone who work in the health tech? Okay, good to know. Yeah, a lot of, so basically, I think so you will understand the context. And what I'm also trying to, healthcare needs people, for example, so we have AI engineers. So if the AI engineers who also understand the health system, or the product managers who understand the health system, so that becomes, more solid products can be built, and more resource optimization we can do. So for example, I was never a tech person, but like in my career, I ended up with Qure.ai as a core tech company 3 years back. Then I was always front-ending maybe the operations and the sales side of it, because I understand the health systems. But I'm just urging you all, a lot of freshers are also here. So there's a lot of scope in healthcare. You also can, parallelly, when you getting your tech skills developed, understand the health system as a whole. Health system, what I meant is what is happening around. It's not one hospital. It includes the hospital operations to the delivery of healthcare services across both government and private settings. You can start with India as an example, and you can get yourself equipped with that. Sorry, let me digress a bit. So coming early disease detection is the primary use case currently, which is anomaly detection is happening in healthcare, and which is very much. Even we do that. Qure.ai, we detect lung cancers in early stage, tuberculosis can be detected because lung lesions and anomalies in the X-rays that can detect. So that is the very common application which is having. Then the other thing is operational efficiency, right? So detecting, work. 1 second. So this is just one application of early stage detection. I just put as a duck. So so imaging, right? Medical imaging, for example, in X-ray. So AI can look at an image and say it is a cat or a dog. So similarly, right? X-rays. So you know how X-rays are uniform and universal. So always a TB lesion looks same. Always a lung nodule looks same. And that is like whether you're an American, Indian, African, doesn't matter. The anatomy, and as long as the anatomy is same, and the evolution is already done. So it's all same and same patterns. So what AI, how the program is built is, every company source, here this case, X-ray data has been sourced, and also we make the algorithm understand, train them to understand how a lung nodule looks like, or how a tuberculosis lesion looks like, how a scoliosis looks like. So certain health conditions, so we train the algorithm. So then the next time the algorithm sees a lung nodule, so that flag to the doctor, the user. So here again, any AI product, the user is always, right? For example, if something is communicating that it is anything alarming, we cannot communicate to the patients directly due to the regulatory concerns. So it would be the doctor or the healthcare provider. So there would be the alarm going. So that is one application of anomaly detection and AI together, which is happening. And this is, like most of these conditions where if the detection is happening through imaging, it can be done. But again, the asterisk here is, or the point to be noted, this all has to be confirmed by a medical professional through the confirmatory test. Because as long as you look at the image and detecting through an AI, is still not regulated in the final call. So I think this is just, I'm not digressing, but just to give a context, since I said about my company, how we do is also, like, it's always good for you to understand the workflow. So that is why I put this. So this is how we do it in an actual operational settings in a workflow. So any X-ray ordered for a patient, then the scan comes to the scan is DCMO is basically the gateway, DICOM in and out, and that X-ray. So we remove the patient health identifiers, and the DICOM format, it's always in DICOM format, that comes to the cloud, and then it gets processed. Then if at the time of processing, the algorithm identify whether there is a nodule or not, and if there is a nodule, it flags, and it goes back to the server where the gateway, where the premise is there, and then it will say that this is re-identify the data. This de-identification and re-identification always happens within the workflow due to the patient health identifying information data. And then, whatever information has come through, this has to be correlated with the clinical history and patient data. Either the EMR can be integrated or the doctors can be looked into it. Then the further treatment or further action can be done. This is the workflow in most of the AI applications in healthcare. So yeah, this is why I just thought this is our model of detecting early stage lung nodules and anomaly detection. That is why I got just an example. Then monitoring vital signs in real time. This is like very common, very widely used. Like you have monitors, health monitors. Like if anything happens on any of your parameters are going down or coming up, so that is an alarm, and that has to be done. So this is again, stroke is another area, like brain swellings, everything can be done. And then another thing is, in the beginning, Manav slide, he said, right, hospitals or healthcare is always burnt out. Usually, there's a lot of, the tech side of the corporate side is comparatively, we do have a little more structured work patterns, Monday to Fridays. Even if it is we all work from homes are a little more flexible, a little more structured, but hospitals across the globe doesn't work that way. It's always burnt out. It's always chaotic. You see there 100 people running, and even you don't know who's working with you. There could be consultants coming in, there could be locum doctors coming in. So it's always there's a sense of chaos you'll feel when you walk into any hospital has handling patients, bystanders, securities. So you think of the workforce or non-workforce or the people around that system. So that is where anomaly detection can be done, right? So any abnormal patterns in hospitals, for example, take an example of insurance. Insurance is there's an insurance fraud could happen. So there's a lot of anomalies, the way some of these things. So that is where we train the models and understand how is this insurance frauding is happening, or adverse reaction in the drugs or supply chain. If someone is for example, I have a setup with one of my one of the procurement partner, and every time my data is like saying this, some same drug is coming in from a specific vendor and on a on an inflated pricing. So these are the anomalies which can be detected and identified. So that is where hospital operations has to be monitored closely and has to be done. And this is like, this has done in the past, but now with the power of AI, with the power of the new age technologies, we are trying to automate things. And this is like the ER admissions. This is another example I just took. So anything, right? I mean, if you're seeing, right, for example, in Bangalore hospitals, it is seeing that Kanakpura area, or like take any example, there's like more flu cases are coming. If it is a one single flu coming in any area, it is fine. But this one area, specific diseases coming to the hospital, that means there's something to be investigated and something to be done. So that is like a couple of examples. This I already mentioned. Insurance claims, prescriptions, all are like there's a lot of anomalies happening it, and there is a scope for it to worked out for health tech companies and healthcare programs to do that. So yeah, medical equipment and monitoring medical devices and equipment. Again, I mentioned at the beginning. So this is another application where we need to encourage companies to work in, and this is also a high impact area. Drug response and personalized medicine, like basically drugs usually has adverse reactions, so it doesn't happen to always with everyone. We need to know like how the drug adverse reaction is happening. For example, if it is happening to some patients with a particular disease thing pattern, so you understand that is an anomaly, and there is a scope to investigate and understand what exactly it is. So I think current trend is what we mentioned, and future trends in this is like genomic data which is already in place, and this is also going to come soon. And then speech patterns and social behavior anomalies, and this is something mental health or something that's going to come. And if you think through, like we humans have a pattern, right? I mean, this is like we have seen instances where we say it, like mentally manipulating people or like toxic behaviors. Everything is in a pattern. So going ahead, I think there would be that sort of analysis is going to happen in our patterns and behavior, and people can predict like are you a real or a manipulative person. Even in relationships is going to work out. So that is the level where things are going out. So I'm just so this is a cognitive understanding. This is currently due to regulatory concerns and due to different concerns, nothing is in place yet, but this is all of the scope of it. Then pandemic prediction. So for example, COVID came, we were maybe like if like some one more onset of COVID is coming, I don't think then it's gonna happen in that way. We are now equipped more. We have no AI tools. We have like very good pandemic and endemic responses in our country, so we can understand this data more analyzed. When end of the day, someone has to do it, but the technology is available and there are like workforces available, trained people are available. So this is all like applications of AI where we can early detect things, early detect these pandemic responses. So the idea is AI detection is in the healthcare is AI in the healthcare is way forward. So this is like whether it is anomaly detection can be revolutionized by enabling early diagnosis, the role of predictive healthcare models, monitoring patients. There's a lot to do, and there's a lot we are doing it, and there's a scope to do everything. And this is like I didn't purposefully like I'm not going to speak a lot about it because you guys, two reasons. One, I'm not an expert in it. Second thing is I want I want you also to like if you whenever if you are interested areas in it, you can read about it and understand more. So basically, we machine learning approaches for anomaly detection. There is supervised and unsupervised and semi-supervised. So supervised is simple, like where you have input data, output data is available, and unsupervised is where you don't have that is available. So that would be like label data is not available. So it mostly handles the clustered algorithms where it has to be done. And this is isolation forest. Some of you must have heard. This is one of the technique which is like in unsupervised techniques where anomaly detection is mostly done. So a decision tree is made with the like with the data patterns has been understood, and then key concept outliers are isolated. So this like the basic concepts are available in YouTube, and if you are interested. But there are like other languages, other patterns, and other models are also available. But this is currently commonly used. I urge you all to read about it and understand it. And also, I want to end it in a note that we are here in Bangalore. If any of you are interested I know many of you are freshers and anything interested to work with us, interested to collaborate, feel free to reach out. I mean, if there's something, I would be happy to collaborate if at way it is possible. That is also one of my interest area to take up this session. And thanks with that.